All right, we are streaming and ready to go.
All right. Welcome, everyone, and thank you so much for joining. Just a reminder for those of you joining us on Zoom to please keep yourselves muted just to help to avoid background distractions. And thanks to those who are also joining, watching on Facebook, whether you're streaming live or watching later. We're so excited to have the opportunity to be able to just chat. And so we'll go through and just do some introductions here. So I'll start. I'm Representative Liz Boldon. I represent District 25B in the Minnesota House, which is northern Rochester and a piece of Cascade Township. I have just finished my first year in the legislature, so learning lots, and we're in interesting times, of course, and we'll get into more of that. And I'm really grateful to be able to have a conversation with Rochester City Council President Brooke Carlson, and moderating our conversation is going to be the wonderful Manal Abbadi Whitfield. And so thanks to both of you for joining. So just a bit of background about me. I'll start off just briefly. Like I said, just finished my first year in the legislature. My committees that I'm sitting on in the legislature include health policy and finance, human services policy and finance, early childhood policy and finance, and local government division, which allows me a bit of connection to President Carlson and the Rochester folks, among others. And so my world outside the legislature is that I work as a nurse in leadership and education, staff education. And so I think we'll get into little pieces of that as well. Certainly lots happening in that world also right now. So our plan for this evening is, well, like I said, I'll pass it off to President Carlson in just a moment to give some introductions. And then we're going to just take questions. The point of this is to just have some informal conversation, be able to hear from folks and answer questions. And I think it's certainly important to me, and I'm confident that I feel that Brooke feels this way too. Is that it's important to us to hear from you and just to be connected to folks. And so, looking forward to the conversation. So, with that, I will hand it to President Carlson.
Thank you so much, Representative Boldon. It's wonderful to be here with you all tonight. Thank you for joining and taking the time out of a very busy schedule and back to school week. So many parents are just wishing their kiddos through good days and hoping those masks help with the spread of COVID. So I wanted to share a little bit about my role on council and then frame up some of our strategic priorities and sort of big pressing issues that we're working on right now, to help you all frame any additional questions that you might have for me. So as you likely know, I'm new to council as of January, and the council president role is not ward specific. So along with the mayor, I am represented by our whole community and thus represent the whole community. It's called the at-large position. My role is to manage the meetings, but I also get to sit on I have a couple other really amazing, important roles. One of those is sitting on the DMCC board. So I am deeply involved in economic development, both through DMC and through the Rochester Area Economic Development Board. I'm vice chair of the Airport Commission. This has been such an important role, or such an important year for the airport, as they've navigated so many incredible challenges and really come out strong and forward thinking and looking to a really bright, expanded future. I also am the chair of the Olmstead County Justice Commission, which is just about the most gratifying, important work I could have imagined stepping into. It's an opportunity to work with our city and county attorneys, our sheriff and police chief, elected officials and administrators across both the county and the city, as well as our judicial system, and really find spaces where we can collaborate and work together to improve equity and other issues in our justice system. So that is really a meaningful role that I've been grateful to step into. And then I also get to work with legislators, because we at the city have priorities we want highlighted and carried forward to our legislative partners. So have had meetings lately with Representative Boldon and others of our other members of our legislative delegation around what our bonding priorities are from the city perspective. So we work as a council to identify those top bonding priorities and then work with our legislators to make sure that those get carried forward and considered at the state level for funding. We'll also be working on our legislative agenda more broadly, so the opportunity to have additional conversations with our legislators. So the council so far, since I've been on it, obviously we have 4 new council members, we have a new administrator, a new city attorney, there's a ton of new leadership in Rochester overall. We have been going through a process to identify what this council's set of strategic priorities are, and our priorities that we've gone through and agreed on together are, of course, providing quality services for quality living, focusing on economic vibrancy with an emphasis, of course, on growth management as our city grows and changes and evolves. And then also sort of a new lens, and one that I really have been passionate about, is around affordable living. So knowing that we have a really important situation to emphasize related to housing, but affordable living is a much broader concept. And the city has a lot of leverage, and even more so with our partners at the county and our school district and our private sector, around surrounding people with opportunities to thrive. So that means access to affordable quality childcare, means access to affordable quality transportation, healthy food, safe places for exercise via parks and recreation, energy efficient, low utility costs, really surrounding people with those needs that allow them to live in our community and work in our community instead of needing to live someplace else. We also underscore all of that with an emphasis on efficient government processes. This has been an emphasis of our new city administrator, and something I'm really committed to as well as we move forward is in solidifying our work together as a council. So those are our strategic priorities. We will be using those in the next few months and are already started as we go through our budgeting process and thinking about nobody's favorite conversation, but our tax levy. We had a flat tax levy last year, so we're looking at how to make sure we're being really good stewards of our public dollars, but then also acknowledging that we are a growing, thriving city, and we need to make sure that our city government meets those expectations. We're also looking at issues around Rescue Act dollars. Our city got a disproportionately small amount of Rescue Act dollars. We got about 17 million to use over a couple of years, compared to like Duluth, which is about the same size, that got about $60 million. So we're really using those to target our budget stability and some other investment in people and economic development and housing. We are also, of course, looking at parks investment, transportation, ongoing public works and infrastructure projects, DMC. There's a whole swath of issues that we're diving into, and I'm happy to talk about anything that's meaningful to all of you on the call. I know that COVID is a top priority in conversation right now as well, so we can talk a little bit about that. But first, I'm going to turn it over to my colleague, Manal Abbadi Whitfield, who I've had the honor to get to know over the last year and a half or so. She is a trained paralegal, but also a really amazing community activist and organizer, and advocates for several issues she's very passionate about. The latest thing that she's been guiding us through is a back to school campaign and collecting resources to support kiddos who are going back to school and needed some extra help in getting their supplies and just ready to go. And she did that in partnership with the community engagement resource team. So Manal, I will turn it over to you to introduce the session and dive into questions.
Thank you so much, President Carlson. I really appreciate you both joining us tonight to have this conversation and to come to the table and listen to our community's concerns. We are looking forward to engaging with you both and learning more about your guys' roles as the City Council President and on the state legislature. So we're really looking forward to learning what those roles entail and figuring out how we can work on the community's issues together to make sure that they're addressed on both levels. And so currently our community is very concerned about COVID-19. That is a big issue that we're facing at the moment. And one of our subscribers or viewers has submitted a question asking, what are we going to be doing about the increased COVID-19 cases in our city? And why won't the city institute a mask mandate? And so I would like for you guys to take this opportunity to kind of explain the differences between your guys' roles and how we can handle this issue on a state level as well as on a city level.
Thank you. And actually, I might let Representative Boldon frame it up from a state level. The city is quite a hot topic right now, but Representative Boldon, maybe you can say what the state is up to.
Sure. Yep, I can speak to that. And I mean, absolutely, COVID is, at the top of all of our minds, probably is, we've been, in a global pandemic for a year and a half plus at this point. And it continues. It's not ending. We are still very much in it. We, in our community, we, as pretty much everywhere across the state and really across the country at this point, we are an area of high spread. So the first thing I would just say regarding COVID is please get vaccinated. If you have not, and you have questions about vaccination, please reach out to your healthcare provider and get those questions answered. That is the number one thing that we can all do to get to a better place with COVID. And I would say, as sort of was mentioned in the question about masking, that in addition to vaccines, we need that sort of layered approach is how I've heard it referenced. And so that means we need to be doing a number of things. We need to get vaccinated. We should be wearing masks. We should be, thinking about ventilation and being outdoors is certainly safer than being indoors if we're in groups of folks. And so it's a number of things, and we know, and certainly over the course of this, it has become abundantly clear that it takes all of us working together. This isn't something that is about individuals, it's about the collective, right? Because what happens with one person affects another person. And so what I know about Minnesotans is that we look out for each other. And what that looks like right now is that we're using those layered approaches and getting vaccines, wearing a mask, all of those pieces. And so at the state level, and maybe I'll just back up for just a moment. So broadly speaking, and the legislature is not in session right now. So our session ended with a special session at the end of June. So we're in what's called the interim. We may get called back for another special session here this fall. That remains to be seen. But we will go back for the next regular session on January 31st. And so there's nothing officially that, with the legislature not being in session right now, there's nothing officially happening. We're not taking votes or having committee hearings and those types of things right now. There certainly is work happening, as far as engaging with community and things like this, and having those conversations and some policy work, but, behind the scenes work is happening as well. As last year in the legislature was a budget year. We passed the $52 billion state budget. And so next year will be a policy and bonding year, as President Carlson mentioned, bonding projects. And so certainly COVID was a topic that we worked on in varying avenues last year, and that will continue to be the case next year, as it really is our role to be sure at the state level that, we're supporting communities as best we can. And so certainly we know that COVID has upended many, many parts of our lives, and that will continue to be the case. And so there were a number of things that we passed and did over the course of the session last year to help support communities. Certainly financially is one piece of that, but also just things like the, making sure that communities have the vaccines that they need and supplies and all of those pieces. And so, I imagine next year when we go back into session, things are changing quickly. So it's hard to know exactly what things will look like, but we'll continue to have discussions around how to support communities and be sure that we are keeping people safe and healthy, that communities have the resources they need to do that. Yeah, I guess that's maybe where I would leave it there. Yeah, we'll continue to have those conversations. And I will also just maybe say one other thing is that next year will likely be different than last year in that, last year, the governor, we were in a peacetime emergency. And so that allowed Governor Walz to take certain actions because of that designation of being in a peacetime emergency. And so that ended at the end of our special session. So those, that the opportunity to do some of those things at the state level, aren't in place anymore. So for instance, I have gotten questions about, well, why, can Governor Walz just make a statewide mask mandate? And the answer to that is no, not with that, not one that would be sustained, because we're no longer in that peacetime emergency. And so that would have to be voted on by the legislature in a special session. And so, and it would not pass out of the Senate, I can tell you that. And so that's sort of where we're at the state level in terms of COVID right now. And again, that being said, things are changing quickly, and we will, kind of see how things go. And I will certainly continue to advocate and push for, making sure that we are making decisions based in science and evidence with the goal of keeping everybody safe and healthy.
Thank you, Representative Boldon. That last piece around the governor and the peacetime emergency is really important for how the city has an option to go about thinking of a mask mandate or any action related to COVID. So many of you likely heard about or saw that the mayor about 2 weeks ago made an emergency declaration that did bring forth a mask mandate in sort of a limited capacity. The idea was where children are present or potentially vulnerable adults are present. So the council had 3 days to act to decide whether or not that would stay in place or whether it would be rescinded. So it was very controversial as how it came about. And I think we could have all handled it better together as the mayor and council working together to figure out what would have passed council. I think we missed an opportunity. That you probably saw my comments about what sort of steps we need to take to make sure policy change is effective. It's not just writing the language, it's figuring out how it can be implemented and how it can be enforced, and really supporting our business community and our nonprofits, those who are responsible for implementing it, to make sure that they have the tools they need to actually require masks in their spaces. So we had some work to do. We didn't get there in time to have it pass the council. You probably saw that we did indeed pass a resolution unanimously that strongly supports following CDC recommendations and science and best practice and everything. I know that many aren't feeling comfortable with just a strong recommendation, as that doesn't necessarily motivate people to follow those guidelines. Our most important message here is vaccination. So no matter what, the city's stance on vaccination has been written and is clear. We absolutely recommend that vaccination is the top approach. And then, as Representative Boldon mentioned, these sort of other layers of social distancing and masking and cleaning and so on and so forth. But I did see this data point today and shared it on social media around the CDC released data that unvaccinated people who are sick with COVID are 17 times more likely to be hospitalized than those who are vaccinated. So we just need to keep pushing that message. And the way that we're doing that right now through the city is through our partnership with other major institutions in our community. So we're briefed regularly by public health experts in infectious disease and statisticians who do predictive modeling at Mayo to make sure we're up to date on science and can be considering action. But also the city is part of what's called Rochester Ready, which was really active during sort of early days of the pandemic and supporting our business and and nonprofit community in making sure they're implementing best practices. So right now, that group will be working on a campaign to promote not only masking within those settings, but also how they can promote and provide resources for businesses to encourage or potentially require vaccination. So there's a lot of good work happening with the League of Minnesota Cities, with Rochester Ready, to keep pushing wherever we can to encourage best practices, and of course, top of which is vaccination. So just my personal perspective is, I think that we need to keep working as a city on how we think about this over the long term. This is not like just done tomorrow or done in 2 months. This is something we will be living with for our entire lives and many, many generations to come. So how can we as a city be more planful about what will be our approach? What are the tools we have? At what thresholds do we use different tools? So at what point do we actually institute a mandate compared to, recommending businesses or different spaces are masks? So I think we have the potential to do some thoughtful work for longer term planning. And I've been talking to some of my colleagues about that. But as far as a mask mandate going into place today, it's not going to. We do have an emergency order drafted that would be potentially ready to use. We are absolutely open, or at least I'm speaking for myself, but I think several of my colleagues are open to continuing to watch to see what happens with kids being back in school and being ready to respond if we need to. But yes, it didn't unfold in my dream way, and I wish we could have done it differently. But alas, on we go and keep trying to do good work together.
Could I just jump in? I appreciate your comments around thinking more long-term, because you're right. This is not going to be over a month or two from now. We're going to be on this path for some time. And there's, we're in a bit of a wave right now, and it will get better, but there's going to be more waves. And hopefully sooner rather than later, we will be able to encourage everyone to get vaccinated, but we know that isn't the case right now. And so just a note to everybody listening that, we know that our littles under 12 can't get vaccinated. So while we say, vaccines are the way and the path to keep you from dying and being out of the hospital, just remember that, kiddos under 12 don't have that option. They can't get vaccinated. So what that means is all the rest of us need to do the best we can to keep them safe. I hear from parents quite a bit who say, it feels like me and my kiddos are just being forgotten here, that, I'm, other people aren't, helping me keep them safe. And that just feels really bad. And I know you've got, your kiddos are younger than mine. And so just to keeping that in mind for everybody that, again, it takes all of us to, to protect each other and keep each other safe and healthy. And so we all need to do our part. And right now that's all of the things: vaccines, masking, distancing, all of those pieces.
Yep. And we try to live those values as a family as well. And my kids are masked wherever we are in public spaces. So am I, and my kids will be at first in line, or as soon as they're eligible to get those vaccines, they will. So trying to live our values clearly in the community.
Well, thank you, Representative Boldon and President Carlson, for that explanation on thoroughly explaining why, we can't get those mask mandates in place, but also encouraging our viewers to go ahead and get vaccinated and continue to live and practice safe social distancing, wearing your masks to minimize the risk to our community. I think that's really important to note. One other question that we have that is COVID related is, what is the state doing to get the Delta variant under control and stop a new COVID wave? So that is kind of more catered to the state, but I think we can address it on both the state and city level. What are we going to do to kind of ensure that we control the Delta variant, and what are we going to do to ensure that there isn't a new variant that rises?
Yeah, I mean, that's a great question. It falls along the same lines of the things that we've mentioned, right? So, I mean, we are in a wave right now. I mean, we are in it. And I we need to do all we can, for a number of reasons, because we want to keep people safe and healthy and out of the hospital, because we want to support healthcare workers who are
Businesses.
exhausted,
Yeah.
and businesses to be able to have businesses stay open. I mean, there's just so many reasons. And so it's all of the things that we've been talking about. The way that we prevent another wave is vaccines, masking, distancing, hand washing, all of us doing those things that we know are the right things that will help to keep this from spreading. We have to stop the spread, essentially, because that's, every time the virus transmits from one person to another, it's an opportunity for it to mutate and for another variant to arise. And so, if we want to stop the opportunity for other variants, we need to stop the spread. And so that means that layered approach that we just talked about. That's what I would say about that.
Yeah. I'm not sure I have a whole lot to add, other than we know that this isn't the last wave, and we will be facing these, like I said, in perpetuity. So how do we continue to be thoughtful about when we use what interventions, and what are our tools? We're all learning so much constantly, and learning what the impact is of long COVID and different variants of COVID, and what the impact is on kiddos. And COVID touches us at every level of our community, whether it's missing work because you're home quarantined because your kid was exposed at school, or schools closing, or businesses having too little workforce, or having exposure and closing, to our healthcare workers being exhausted and our hospital beds being full, and really obviously negative health outcomes. So it's just trying to be as proactive as possible, and figuring out what our risk tolerance is, I guess, as a community. How are we going to live to preserve our mental health, but also stay as safe as possible with the disease as it evolves.
And again, I think just going back to it is that community piece, because what I do doesn't just affects me, it affects people around me, and even beyond that. And so I think about that, the capacity of our healthcare system is being strained, and that affects not just, especially if we take a bigger look and look around the country, especially in the South right now, where their spread is just rampant and cases are just rampant, and their healthcare system is extremely strained. And there's, in some states, there's no hospital beds. That affects not just COVID patients, that affects patients who have a heart attack or a stroke, or need a hip replacement surgery, or their gallbladder surgery, or, have cancer and need treatment. I mean, it affects everyone. So what we do doesn't just affect us. And the other thing I will say that I sometimes hear people talk about is, I'm young and healthy, and so, COVID isn't going to kill me. And that may be true, although young, otherwise healthy people, unvaccinated people, have died and are dying. But it's that long COVID that you mentioned, I think that, is still the unknown. We don't know all of the long-term effects of COVID, and especially with our kiddos, I just think they've got a lifetime ahead of them. And, we don't know what that looks like if they end up with COVID, and they could have a lifetime of health problems. So again, we all need to do our part to protect our littles and everybody in the community, to keep everybody as safe and healthy as possible.
Thank you guys so much for answering that. This one is kind of more so a question that I kind of just thought of. And, we've been hearing a lot of communities of color say, I'm afraid to get the vaccine. And, there's history obviously there that has built that fear and that resistance to getting the vaccine. But what would you say to communities of color to encourage them to get the vaccine? And also, what are we doing on the city and the state level to help communities of color get the vaccine?
Liz, do you want me to start?
Go for it.
Okay. So as somebody who does a lot of work in the space of equity, I think it's less important what I say and more important how we work with our communities and leaders who are a broad swath of representation from those various diverse communities, our multicultural communities, to understand what the barriers are and how best to support them in being vaccinated. part of what's happened during COVID, and I've been so fortunate to watch it unfold as a leader in the nonprofit community and now with the city, is how differently our government is working and how much more authentically our government is working with various populations and various sub-communities within our broader community here in Olmstead. It really is moving towards a best practice and sort of a co-design or co-creation model of how to make sure that the needs and the interventions actually match up and are driven by the community. So I think we've actually done some really good work here. There's always work to keep moving forward on, but my understanding in the area is that we are really doing quite well in vaccination rates among our multicultural communities and our Black communities. So I feel very hopeful. I believe that is the way we need to do work moving forward on issues around COVID and vaccination, but across the board and actually improving health outcomes across our community. So my 2 cents.
Yeah, I would agree with that. I think, we need to do more. I think there are, still opportunities to, communicate clearly and to reach out to, folks who are, doing the work in those communities for, there are folks already doing that work in those communities. And so it's not necessarily for us to stand up something new or different, but to work with partners who are already doing that work to be sure that they have the resources that they need, because those communities know what they need. We need to listen to that.
Mm-hmm. And then take action.
Yes, absolutely. Yeah. And to, I think the first part of your question was, what can we do, or what would I say to people of color who are hesitant? I think what I would say is to reach out to people you trust, reach out to your healthcare provider, reach out to other people in your community who have been vaccinated and talk to them about their experience. Oftentimes when I talk to people who are hesitant about getting vaccinated, they have valid questions, and that's absolutely fair. And oftentimes when they get answers to those questions, then it makes sense to them and they feel more comfortable. So, I worry about just painting a broad brush of people who are not vaccinated, just to kind of toss them away as, with some sort of label. I think we need to have individual conversations, and that is a slow and difficult process, but that's the work that we need to continue to do, because we need to get everyone vaccinated who absolutely can be.
And minimize barriers as much as possible, and not minimize the things we think are barriers, but the things the community is telling us are barriers. So
yeah.
Thank you guys so much. You guys did an amazing job answering that question. I think you hit the nail right on the head. It's about having those conversations and opening those avenues to have those conversations so people can understand the risks and the benefits and make the decisions that are best for them, but are educated decisions as well. And that's really important. So we'll move on from the COVID-19 topic. I think that is a hot topic right now. But another question that we had submitted by one of our community members is, what are the most important investments we can make to improve the economic security of Rochester families? And I understand that there's, 2 different levels here that we can answer that question at. So how about we start with President Carlson, since you're on City Council, and then we can move on to Representative Boldon to talk about what we can do on a state level.
I love this question, although it's gigantic and there's no super streamlined way of answering it. But I think this concept that we have now put forth as a strategic priority as a council around affordable living is really that holistic approach to supporting families and individuals in living their best life and giving them the best opportunity to thrive. So one of the things besides this housing first approach and opportunities for families who have been historically excluded from opportunities to build wealth, I think home ownership is one of the key investments, and that's something that would require that the city can't necessarily do alone, but can do in partnership with the Rochester Area Foundation and our county and Mayo Clinic and others really committed to advancing housing in our community. I also think one of the most important things is access to childcare and early childhood education, and really building those foundational blocks for families, giving parents an opportunity to engage in workforce and in education to advance their own careers. Really, that childcare, whatever it looks like, whether it's family, friends, neighbors, the center, but having access to quality, safe spaces for their children to learn is really important. And I think that's a new space for the city to be thinking about. And the way we think about it is often in either collaboration, is always in collaboration, but there's this idea that as we build more housing or more projects where we invest through our tool called TIF, tax increment financing, there's potentially a way to support childcare being part of those developments in a tax beneficial way. So that's one thing we're thinking about. And then there's also a big initiative driven by the mayor that the city is part of, related to advancing BIPOC or Black and Indigenous people of color and women in particular in our development or construction related industries. So really investing in some of those upstream barriers to getting women and people of color into the workforce with well-paying jobs and benefits and everything. One of the, again, foundational barriers is access to childcare in order to do that. So housing and childcare are really two of my top areas I think we need to invest in and be really solid in our policy approach too. Liz?
Yeah, I would agree with that. And I'm going to piggyback on the childcare topic because I think that is just hugely important. That's one of the things I hear most from families and parents, and, people pay more for childcare than they pay for a mortgage, prohibitively so. And at the same time, the people doing that really, really important work are not making a living wage. Being a childcare provider is the lowest paying job that someone with a high school diploma can have. And it's not right. And so we need to make investments in that space. I am really excited to be appointed to a task force who is going to be looking at that very topic. It was a bill I carried in the last session to create this task force to look at that issue, how do we make childcare affordable so that the kind of the gold standard is no family pays more than 7% of their income towards childcare, accessible. And then there's compensation for people doing that work that they are making a living wage. So that is huge. Another space I think where we need investments is in healthcare. Healthcare needs to be accessible and affordable for people. We're the only, civilized country where people are going bankrupt because they're paying for healthcare bills, and that's just wrong. Everybody should have access to quality, affordable healthcare. So I think we certainly can make investments there. Other things I think about are things like paid family medical leave. So people have the ability to take time off work when they are sick or to take care of a family member, that they don't have to choose between doing that and keeping their job. It's investments like that help to create that economic security, to be sure that people can do what they need to do. They can take care of their families and their kids and their loved ones and, make a living wage and be able to do all the things that they need to do. And I would just put in a plug. We can make those investments. It's a policy choice whether we do that or not. I would advocate. We had bills in our session last year that would allow us to make some of those critical investments by making having the very wealthiest Minnesotans, people who are making more than $1 million a year or more than $20,000 a week, having them pay their fair share, pay a little bit more. So we can do, things like paid family medical leave and those critical investments. And we were not able to get it across the finish line last year, but we'll keep at that because it's absolutely the right thing. And I would say it's overwhelmingly popular by the vast majority of Minnesotans. I talk to people all the time who say, absolutely, yes. If somebody is making $20,000 a week, they should be paying a little bit more in taxes so that everybody, people are able to afford childcare or be able to take time off work when they're sick. It absolutely makes sense to people because it just feels like common sense. So still work to do in those spaces. And so we will keep at that.
Manal, I do have a response to the Afghan refugee question. I don't know if we'll get to it, but I could also put it in the chat if we don't have time.
I did not see it update on our, let me just exit in and out here.
I can see it. Do you want me to repeat it?
Do you go ahead and, well, here, how about
It's
this?
pretty quick, so I just wanted to be sure to answer it.
Yeah, let's get that in there. Okay, so I don't think I'm seeing the question because I had to bounce in and out of the Zoom call due to some outlet charging issues. So maybe if you read it off and we can address that, that would be great.
Sure. So the question from Ms. Mann is, will Afghan refugees be coming to Rochester and how can our community help? Great question. The city had been in conversations already with our Intercultural Mutual Assistance Association, IMAA, which I'm so lucky to work with as a consultant as well. So I wear multiple hats with that organization, as well as Catholic Charities. And Catholic Charities is the organization in Southeast Minnesota that organizes the the welcoming and resettling of refugees coming into our area. So my understanding is Rochester was already looking to welcome refugees from multiple countries this fall. So that's great news. It is looking like we will also welcome a few dozen, at least in the short term, Afghan families and refugees. So the best way, at least my understanding is the housing is the biggest issue, but the best way to connect with how you can support families coming in for resettlement is by contacting Catholic Charities of Southeast Minnesota. So that is my quick response. I don't know, Liz, if you have anything to add.
I really don't.
But thank you. Such an important time to be supporting refugees as the U.S. continues to welcome in more refugees than we have in the recent past.
Yeah, I guess what I would add, this isn't necessarily specific to Rochester, but across the states, Governor Walz has said that, we absolutely, Minnesota welcomes refugees. And so absolutely we'll create that welcoming environment and invite people in.
Great.
Absolutely. I think that's wonderful that we are getting people resettling here, and we look forward to welcoming them in our community and making them feel very welcome here in Rochester. So we look forward to it for sure. Okay, so the next one actually is a question that I'm going to just throw in here a little piggybacking off of our previous question regarding how do we create that economic security for Rochester families. I would like to address how do we create economic security for communities of color and, the protected classes. So people that might have disabilities and don't have, the same access to employment opportunities, people of color that might get passed over for employment opportunities. How are we addressing that on the city level as well as state level?
Sure. So I mentioned, I'll go quickly with Representative Boldon. I mentioned the investment in housing. Obviously, that's a big role of the city, is using tax increment financing, TIF, to basically offset taxes of new developments, which are largely rental, that provide different levels of affordability for people making different incomes. Now, that's a part of the strategy, of course, to support people in getting housing that they need. Much bigger than that is how do we acknowledge the wealth gap in our communities of color and our white communities. The data is just
it's a large disparity.
Yes, it's a large disparity. Sorry, words are hard this evening. That we incontrovertible, I guess was what I was trying to say, that we know that investing in not only home ownership, but really supporting our BIPOC-led businesses and other entrepreneurs who want to grow their business and really be part of our economic vitality here in our community. That's something that the city is also committed to. So there are a few different things that we're working on, not to mention sort of providing those foundational things like public transportation and access to safe places for recreation and senior supports. And working now, really, one of the things Councilmember Bransford and Councilmember Kirkpatrick are very passionate about and committed to, and I am as well, is around accessibility and making sure that we have places for our children to access playgrounds. So having adaptive playgrounds, making sure that our housing is accessible and, or at least has some level of accessibility. And then also one of the things that is really important, I think, is the increased community engagement overall that the city is using. So we aren't just sitting around a table together coming up with programs to apply to our communities, but we have made a commitment to a community co-design process. So designing our transportation systems and designing DMC projects and thinking through issues, specific to our LGBTQ plus communities that are led by the community or led with the community. So that's a really important shift that I think is just starting to happen. We're demonstrating we can do it. We're showing how we want to pay consultants with community expertise. I mean, community consultants, not outside consultants that we're bringing in, but community members to contribute their lived experience to being part of developing those projects. So that shift as like an overall way that the city works is really important. I said I would be quick and I wasn't. Representative Boldon, over to you.
That's okay. No, I think that's great. And I would echo the community engagement piece. I think from a state level, I think it's really important to reach out to those communities of color and hear from them. Again, it's not for us to just be at a table and decide this is what should happen, this is what works. It's we need to hear from folks and hear from communities what they need and what they want and what works in their communities, and then listen and take action on those things. I also will say, over the course of the last session in the last year, there was a lot of work that we did in the House, especially on diversity and inclusion and investments in communities of color, and being very intentional about that. We had some very lively discussion at points, during session on the floor about those topics. And there was a lot of fantastic testimony in committees, and it isn't an issue like separate and by itself. It's one that we need to have included throughout every issue, right? So when we're talking about housing, it's intertwined in the decisions and the investments that are made in housing. When we're talking about education, it's intertwined in that discussion about education. When we're talking about healthcare, I mean, it's threaded through all of the other topics with intention. It isn't, we have current systems, with built-in systemic racism. And so we have to be aware of that and recognize it and work to dismantle that and create a new system that works for everyone. And so that takes intention and time and really difficult conversations. And, we are not there yet. We have lots of work left to do, but that's what I will continue to do at the state level, certainly.
Thank you so much, Representative Boldon and Council President Carlson. I know I put you guys on the spot on that one, but that is an issue that matters, I think, to a lot of people in our community. And I think you guys are champs of diversity and inclusion. And so we always want to hear what you guys are working on in regards to that specific issue, because you guys are really great advocates for that. And so thank you so much for your hard work in regards to that. We do have another question from one of our community members, and they are asking, will you defend the Huron Rookery? Am I pronouncing that right? Yeah. Heroin?
The blue heron rookery.
Yeah,
Yeah.
it's not
Okay.
the heroin rookery.
Yes. So do you want me to start and then I'll hand it to you? So for folks who are not aware of this issue, so there is a blue heron rookery, which is like their habitat that is in Olmstead County, where there's a proposed development that would disrupt this, their habitat. And so, as an environmental issue, there's work around, how do we protect the habitat for these animals. I will say at this point, I believe that is in the hands of the county. That's where those decisions are able to be made. So I don't, from a state standpoint, I don't think there's a lot that we can do legislatively at this point for that, but I certainly am an advocate for environmental issues and our natural resources, and would advocate for that. I don't know if you have anything else to add to that.
Similar, the city has made their own statement, so above and beyond that, as a city policymaker, I don't have any space to work as an individual. I can certainly talk to my county commissioners. My family can support different efforts, and I absolutely support our nesting habitat for our herons. So, but I can't speak for the city on that topic.
Absolutely. Well, thank you, President Carlson and Representative Boldon, for addressing that issue. Before we wrap up here, there is one question we would like to ask you. What is keeping you up at night? What issues are important to you right now? What issues would you say are, at the top of your platform at the moment? And how about we start with President Carlson and then wrap up with Representative Boldon on that question?
Oh, well, this week, what's keeping me up at night is my kids being safe and sound and happy and encouraged and back at school, and those schools staying open as long as possible. So besides what the school district can do, as the city obviously doesn't have authority over the schools, but really supported the school district making the decision around masks and their really thoughtful, safe school plan. I think the city has a chance here after our whole situation related to the emergency order by the mayor and the city council rescinding it. I think we have an opportunity, as I said before, to put something in place that's longer term and really thoughtful and legally defensible, which I know was one of the big questions because we didn't have that peacetime emergency at the state level in order. So in place. So I do think one of the issues, of course, is COVID. What's going to happen? How is this going to impact our business community, our families, our kids, our workforce, all of those things. And the other thing is, sadly going through this budgeting process for the first time and making really hard decisions about how to use our city's resources, which are finite, and we can't, fund everything we want to and we think we should. So prioritizing and coming to an agreement and really aligning how our resources are used with our strategic priorities that we as a council have identified, which I think are really good. And then how do we adjust the tax levy knowing that it's going to go up? Our taxes are going to go up, but our community is growing, and sort of just justifying in my own head and heart how we balance those different priorities of thoughtfully using dollars, but also wanting our city to be really making this the best place to live possible. So that's sort of what's on my mind right now. Just those things.
Yeah, the list of things that keep me up at night is growing daily and is long. So I will not give a complete list, but we'll say things at the top of that list. Certainly, COVID is on that list, and I worry a lot about the health and safety of people in our community, especially our little ones. I worry about, support. As I said, I'm a nurse. I work in healthcare. I talk to lots and lots of nurses every day, and they are exhausted, and they are, have been through a lot in the last year and a half. And so I worry about them, and how do we, support them and keep everybody well and safe, and the mental health of folks, healthcare staff, and everyone in our community, given that, it's been really difficult times for some more than others and for different reasons, and that looks different for different people. But, all of those pieces. Climate change keeps me up at night. We saw just yesterday, on the East Coast, none of the New York City subways were running because they were all flooded. That has never happened before. On top of, fires and hurricanes, and we are absolutely in the throes of a climate crisis. It's not something, sort of a distant thing that's out there. We are in it, we are living it, and we have to start taking it seriously and taking bold action to be able to survive. That keeps me up at night. The threats to our democracy right now keep me up at night. We are seeing a coordinated and targeted attack across the country to, undermine people's freedom to cast their vote and make their voice heard. And there's efforts to do that here in Minnesota as well. So we'll continue to fight for everybody's vote to be heard, and everybody's voice to be heard, and making voting as eliminating those barriers as best as we can to that. And the last thing I'll say is, what is newly keeping me up is the law that was enacted in Texas this week, which limits the ability for pregnant people to make decisions for themselves about their bodies and what is best for them and their families. So there's a whole lot of things keeping me up at night, and I am a big believer in, though there are lots and lots and lots of things that, to worry about and that are concerning, and there's really bad things happening. I am grateful every day that I know really amazing people who are in the fight and working hard to make our communities a better place. And I'm just really grateful to be in those spaces, and with two wonderful folks who I would put in that camp here today. So thanks to both of you. We have to keep at it and keep in the fight, and there's work to do. And so that's what I'll keep doing.
Very well said. My mother is on her way up to the cities to pick up my niece and nephew right now, who have evacuated from New Orleans, as their family works to rebuild in their community. My sister-in-law's bookstore was badly damaged. So, and they were among the luckiest of those that experienced the repercussions of climate change through such a massive hurricane sweeping through the country. So we're all affected, we're all interconnected, and we are all responsible for working across our community and our different levels of government. I think one of the things we wanted to end with, Manal, is sort of how you all, as you think about issues that are important to you or your family or your community, how you best show up and influence these conversations. And of course, participating in conversations like this, but also figuring out where the issue touches what level of government. And a lot of times it's hard to know. And we're all here as policymakers to help you navigate that. So even if you reach out to me about a school issue or a state issue or whatever, my response will be to make sure that you get connected to the right people. So I think we're all here to advocate for improving our state and our community, and want to make sure that you're directed in the right way to use your energy well. I don't know, Liz, if you want to say anything more about sort of advocacy.
Yeah, I agree with that, and would say, we want to hear from you. So if your question didn't get answered today, I would love to chat with you about it, or shoot me an email. And yes, it is oftentimes can be confusing. Is it a school issue or city or county or state or federal? So if you're not sure, just reach out, and we can certainly help you get connected with the right people to answer whatever the question is. So.
Well, we would like to thank you guys so much for your guys' service to our community, for your thoughtfulness today as you thought about your answers and your responses, for taking the time out of your evening to come to the table and have these conversations. We thank you so much for your guys' time and dedication to this community. We can't thank you enough for all the hard work you guys do. I have seen you both on the front end, at community events, and you guys are amazing, and we're so grateful to have you guys leading us. And we look forward to many more conversations like this and continuing to work with you guys on making our community the best place it can be. And together we can make that happen. I truly do believe that. So thank you, Council President Brooke Carlson and State Representative Liz Boldon. We really appreciated your time today. And if you could wrap up on how people can get in touch with you, how can they follow you and keep up with what you're doing and what's going on, we would really appreciate that.
Sure. Thank you, Manal, so much for your time and commitment to the community and supporting us through the conversation today. We really value you. I can be reached through the city website. My email is bcarlson@rochestermn.gov. It should be pretty easy to find on the Rochester City website. And then I can be found on Facebook at Brooke Carlson, Council President. I try to get back to people. Obviously, we get lots of emails, but I try to stay well connected and easily accessible. And I also just want to end with saying this is a learning process for me. I'm 9 months in and working with all new colleagues in an all new dynamic in a really stressful situation. So I appreciate the grace that all of you have given me. And I'm absolutely fine with saying I screwed up and I'm making mistakes along the way and learning, and just committed to continuing to improve and be the best council president I can be. Liz?
Yes, thank you for that. Definitely, I would say I'm on a learning curve as well, and we'll continue to learn and grow and do the best we can. And I would echo a huge thanks to Manal for all the work that you do in the community and for being here with us tonight to facilitate a discussion. Would love to hear from folks. Please reach out to me via email. My email is rep.liz.boldon, BOLDON, at house.mn. You can Google I have a state webpage as well. Also, you can find me on Facebook or Instagram or Twitter. So would love to hear from folks. Please reach out if you would like to chat about any topic or get questions answered. Really appreciate the discussion tonight and engagement from you all, and hope to do this again soon.
Yes, thank you everyone for joining us. Thank you for this wonderful conversation. Thank you ladies for your time, and we will wrap it up then. Thank you.